Everything you need to know about menstrual migraines. Unfortunately, for women who suffer from menstrual migraines, the period or the time just before it can be almost unbearable. Menstrual migraine is no different from other migraine attacks in its symptoms: headache, nausea, and in some cases aura symptoms such as flashing lights or blind spots. What differentiates a menstrual migraine from a regular migraine is the trigger. It is triggered by the hormones that are influenced by the menstrual cycle. Hence, the term hormonal migraines, which describes the same phenomenon. Who is menstrual migraines? Women are 3 times more likely to have migraines than men. However, her headaches are not always dependent on hormones. Yet 60% of migraineurs say their symptoms depend on their menstrual cycle, from puberty to menopause, and in some cases even longer. Some women have their first migraines when they are teenagers, at the same time they start their periods. This can be a very uncomfortable experience, but understanding what exactly is going on in your own body enables you to take the first step in dealing with it properly. In other cases, women do not experience their first migraines until perimenopause, that is, the period of menopause that is 1 to 2 years before and after menopause and represents the actual change. At this point, the ovaries are producing less estrogen than before, which makes the hormonal changes at the beginning of your period more noticeable. Even after menopause, cyclical hormonal changes are still possible. These changes are no longer strong enough to trigger another period, but they can still trigger menstrual migraines. What triggers menstrual migraines? According to experts, menstrual migraines are triggered either by a drop in estrogen or by the release of prostaglandins, chemical compounds that behave similarly to hormones. Just before the start of your period, your estrogen level drops. Since estrogen receptors are present throughout the nerve system, it is assumed that the sudden lack of estrogen provides an increase in the transmission of pain signals and thus reduced protection against headaches. Prostaglandin is released in the first few days of your period. These are the tissue structures that we have to thank for period cramps. The cramping of the muscles increases the activity of the pain receptors, which makes headaches more likely. Women who suffer from menstrual migraines are in all likelihood more sensitive than average to hormonal changes before and during their period. When does a hormonal migraine occur? Migraines usually occur at the beginning of your period. However, this is not the case for all women. Migraines before or during your period. Most commonly, migraines occur in the 2 days before your period or the first 3 days during your period. Keeping a cycle and migraine diary is helpful in finding out if you have menstrual migraines. You should track your symptoms for at least 3 months to see any patterns. Migraines at other times in the cycle. Migraines can be triggered by many factors other than a drop in estrogen or the release of prostaglandins. For example, PMS may make you crave sweets or alcohol, which can also trigger a migraine. Or you may be more prone to mood swings or stress, known triggers of migraines. Post-period migraines or at other points in the cycle are usually not classified as menstrual migraines. Migraines during pregnancy. Unfortunately, some women also have migraines during pregnancy. This is due to the sharp rise in estrogen during the first trimester. The level of estrogen remains high throughout pregnancy. The good news, after the increase in estrogen in the first 3 months, the migraines often go away. But after childbirth, the level drops again, which means that the migraines often come back. How can I treat menstrual migraines? One can try to get hormonal migraines under control on the one hand with special hormone treatments, and on the other hand with conventional migraine treatments. Migraine treatments. Traditional migraine treatments, such as pain relievers and nausea medicines, are just as effective at treating menstrual migraines as they are for migraines triggered by other triggers. Drug-free treatments can also be an option.